Good afternoon, everyone, and thanks for being here on Mother's Day. And I'm thrilled to be here after the pandemic. And without much ado, it's going to be mostly about all the newer studies that have happened in the last few years and why lifestyle changes are going to be important. So we heard the biggest pandemic is going to be about all the risk factors, mainly, and what is it going to cost the United States as far as health expenditure comes to. So this is just a quick prevalence slide showing that 46% of US adults are estimated to have hypertension based on the 2017 guidelines. 1 in 5 adults, that is 22.5% of them, are not doing any leisure time aerobic muscle strengthening activities that we are all supposed to do. And then obviously there are people who still smoke, 1 in 6 males and 1 in 7 females. So the projection is by 2035, about 45.1%, almost half the population, are projected to have some form of cardiovascular disease. And the total cost is expected to be like 1.1 trillion in 2035, with direct medical costs and indirect costs with work lost and things like that. So, and then as Amanda said, my specialty is women and heart disease. Currently, we are part of Pulse Heart Institute. So heart disease is the #1 killer. 1 in 31 American women die because of breast cancer, but 1 in 3 die because of heart disease. And it is 90% of women who have 1 or more risk factors for developing heart disease. So it's important to start taking action sooner. So we are going to talk about risk factors and how a vegetarian diet can help prevent development of risk factors, and by which prevent atherosclerosis, which is hardening of the arteries. So we divide the risk factors into 2 categories. One is modifiable and the other one is non-modifiable. So the non-modifiable are going to be age, race, and family history. The things we can make a change in is going to be about the cholesterol status, smoking, blood pressure, diabetes, obesity, and physical inactivity. So just to be quick, what is atherosclerosis? It's fatty deposits called plaque that develops within the artery wall. The technical term is going to be atherosclerosis. Depending on which artery it affects, it's going to be either coronary artery disease, which affects the blood vessels to the heart, or it could be peripheral vascular disease when it affects the limbs, and ischemic stroke with many causes when it affects our brain. So coronary heart disease manifests either as a heart attack, which we call as myocardial infarction, sudden cardiac death, or angina. So when we look at all the modifiable risk factors, reducing cholesterol and reducing hypertension have been shown to have the best effects in long-term prognosis. So when we come to cholesterol, there are 2 sources of cholesterol. One is what our liver produces, and the other one is what is through the food. So liver and other cells throughout our body will be producing, and this is where genetics play a major role. 65% of the cholesterol comes from our liver. And then 35% comes from food sources. And all foods containing animal fat and meat products are rich in saturated fat, thereby increasing cholesterol and LDL cholesterol. So how does the plaque buildup look like? So this is just a diagram showing where initially there is a little bit of plaque buildup. By 3rd, 4th decade of life, most people end up having plaque that is going to cause symptoms. So here we see about when a plaque ruptures, then that is when patients are in the hospital with what we call an acute coronary syndrome. So this is a question, but I'm just going to give it the answer. When does plaque start to develop? So people would say, oh, it's going to be when I'm 30, I'm 40. In reality, clearly studies have shown it starts at age as less as 2. So it starts at 2 years, and that is why we have few speakers coming after me talking about why it is important to introduce our kids to a healthy diet and also for us to practice. So this is just a picture of how our breakfast, lunch, and dinner should look like. So we'll get into some of the important studies. So this study, I found it very interesting. It's called the Coronary Artery Risk Development in Young Adults. So the term is called Cardia, and it is one of the newest studies that was just published by Dr. Choi, team at University of Minnesota Public Health. They studied close to almost 5,000 people. They were between the ages of 18 to 30. And this is one of a landmark study, which I have not come across, where they studied them and they followed them for 30 years. So the people had to say, I'm eating like fruits, nuts, legumes, and even though fried potato is a vegetable, that's not considered healthy. So they were giving them what is the optimal diet. And then they followed them for 30 years, 52% reduction in cardiovascular events, which is really a huge thing when we come to population health, because right now we are all trying to go from fee for service towards population health. This type of education is going to be extremely important for our patients. So then the question is, do we all have to do it young? What if I'm 52 now, I want to change. Is it okay to change? So this is a great study, which is called the Women's Health Initiative Study. It had 123,000 and more women between the ages of 50 to 79. So the diet that they followed was called the portfolio diet. And the patients or the people were studied for 15 years. So what does a portfolio diet look like? It was supposed to lower cholesterol because it included nuts, plant protein from soy, beans, tofu, and then viscous soluble fiber like oats, barley, okra, eggplant, apples, berries. So what they found was 14% less likely to develop coronary artery disease and 17% less likely to develop heart failure, which is huge in this high-risk population because they are already 50 plus years of age. And there is another study that I'll be getting towards the end, where they clearly showed that about 22% reduction in dementia when people were willing to follow a heart-healthy diet. So what is the mechanism? Vegetarians and vegan diets, lower risk based on, like we talked about, less saturated and less trans fats. They have greatest effect on serum cholesterol. There is improved insulin sensitivity. So there is reduced cholesterol synthesis, which ultimately will lead to less atherosclerosis. And then the other big thing that is happening now is about apolipoprotein and heart disease. So elevated LP(a) is directly related to cardiovascular risk, which tends to promote atherosclerosis and clot development. Plant-based diet reduces LP(a), and prospective studies have shown that vegetarians and vegans have lower levels of LP(a) and LP(b). And then the other thing that has been shown again is vegetarians tend to have cholesterol that is less oxidizable. So oxidized LDL is atherogenic. So what has been shown is vegetarians, by the different mechanisms, tend to have less oxidizable LDL, thereby preventing atherosclerosis or plaque buildup. The other important thing that is interesting is our bacterial flora of vegetarians and vegans. They tend to produce less of this enzyme called trimethylamine N-oxide, TMAO, as it stands for, which is thought to be very atherogenic. So when people are following a diet that is rich in, or a diet basically vegetarian and vegan diet, their bacterial flora gets altered, that they produce less compared to that of meat eaters. So plant-based nutrition also has an effect on endothelium, because that is another thing that we worry about when people have angina. what is their endothelium going to look like? The endothelium is mainly responsible for nitric oxide production, which is known to relax blood vessels. It prevents WBCs and platelets from becoming sticky, leading to plaque formation. It prevents smooth cell proliferation. So these are all the steps that happen during atherosclerosis, which is being reduced. And so when we eat a plant-based diet, there is more L-arginine, and that is the amino acid responsible for nitric oxide production. So you have more nitric oxide production based on foods that are rich in legumes, beans, soy, and nuts. And inflammation is another big topic that tends to cause atherosclerotic plaque buildup. So plant-based nutrition program tends to reduce the high sensitivity C-reactive protein. And the corollary result is we could restore the body's own powerful capacity to resist and reverse vascular disease. So a lot of information based on nitric oxide and endothelial cell, which is another signal molecule called endothelium-derived signal factor that makes the vascular smooth muscle cells relax. The other product that people pay attention to is called AGE. It's called advanced glycated products and glycation end products. That's what AGE stands for. So AGE tends to be in higher concentration in meat and dairy products compared to the plant food. And there are examples about butter, meat products, and plant-based products. So when there is higher, it has an inverse relation. So it tends to block nitric oxide, and then it increases arterial stiffness, which is all counteractive, which is not good for prevention of atherosclerosis. So low inflammation, high anti-oxidation produces thinner internal, produces thinner carotid IMT. And they have shown in many studies that long-term vegetarians have a better antioxidant state compared to omnivores. And there are many studies that you can look up, which I'll be sharing after the end of the talk. The more fruits and vegetables, the better. And this once again goes back to the same point about endothelial nitric oxide production. So it is dose dependent. The more you eat fruits and vegetables, they have shown some studies, it is more helpful. And there is two types of endothelial dysfunction. One is nitric oxide mediated and the other one is endothelium independent. Both seem to be better with vegetarians. They have better nitroglycerin-induced vasodilation and flow-mediated vasodilation. And if additional nutritional therapies are needed, they talk about using plant stanols and sterols occur in plant foods, vegetable seeds, and grain products, and having more viscous fiber tends to attach to or make the bile acids in the GI tract less available, so decreases cholesterol absorption and reduces LDL and non-HDL levels. So let's focus on some of the newer studies also. So we all know from Hippocrates that let food be thy medicine and medicine be thy food. And he's known as the father of modern medicine. So the question is, will going vegan or vegetarian reduce the risk of heart disease? So we have our previous former president of the American College of Cardiology, Dr. Kim Williams, which we all look up to. He became a vegetarian later on in life. And so I want to say he also became vegan. I might be wrong on that. But he clearly articulates, no matter large or small, all the research studies, most research studies have shown that vegetarians have lower rates of cardiovascular disease, lower LDL cholesterol, lower rate of hypertension, diabetes, and obesity. So he also makes a strong statement, wouldn't be laudable of the American College of Cardiology, like for us, to put ourselves out of business if people start to follow a heart-healthy diet in a generation or two. And so I'm going to talk about a few studies real quick and the cognitions about the time. So this is a study that I really like back in 1960, before any one of us were born, diet in coronary atherosclerosis. So they took 50 patients. They all had confirmed coronary artery disease. So they placed them on a low-fat vegetarian diet. The other 50 patients also had coronary artery disease, but they were in the control group. So they studied them for 12 years. The most important thing to remember at that time was there was no statin available, no stent, no bypass surgery. So by the end of 12 years, 19 of the 50 patients who were treated with the low-fat vegetarian, 38% of the patients survived. In the other control group, all had died by the 12th year of observation. So this was clear where it just looked at diet, but now we have so much armamentarium where we can add our PCI, cabbage, and stent, and use of statin therapy along with this well-known proven dietary regimen. So we all heard about, or we all know, great Dr. Dean Ornish, can lifestyle changes reverse coronary artery disease? And he has a great program for reversing heart disease, University of California, San Francisco. And so this is where they studied patients. It's a small group of people, 28 patients experimental, 20 in the control group, and they were doing coronary angiograms and without using any drugs. So what it showed was 82% of the experimental group patients had shown a decrease or change towards regression. So even after a year, you can start to see changes, but to prevent events, it's going to be a little longer. Then protein sources also matter. So people would say oh, I'm training, I need to get protein. So what I tell my patients is, it is very important to get your protein, but where are the sources coming from? The meat or from vegetables? So there is a great study that was published online, published in 2016. So this is the Nurses Health Study. Once again, a huge study with 131,000 patients or participants, along with the health professional study. So they looked at where are they getting their animal and their plant protein, and they were talking to them about questionnaires. Data was analyzed from June 20 to January 18. And the study results were very profound, where when patients were taking replacing the animal protein with plant protein, they had lower mortality. And this was only based on lifestyle and dietary factors. And it was a clear-cut relationship. So high animal protein intake was increasing mortality. When you take a high plant protein, it was inversely associated, which means you have less risk of mortality. And anytime you substitute a plant protein for animal protein, especially avoiding processed red meat, was associated with lower mortality, suggesting the importance of protein source. So let's ask this question. So we have 100 calories of steak and 100 calories of broccoli. So it is going to be 8 grams of protein and 7.4 grams of fat. Whereas when you're getting your 100 calories of broccoli, it gives you 11.1 gram of protein and only less than a gram of fat. So in addition to that, you're going to get fiber, phytochemicals, vitamins, essential nutrients that we all know prevent disease and promote health. So there are numerous studies. So I kind of compiled the ones that I could. So there is American Journal of Clinical Nutrition, and then there is collaborative analysis of 5 prospective studies. So mortality from ischemic heart disease was 24% lower in vegetarians. This is like a pooled meta-analysis of many studies. And it was very important when you looked at the age group, lower mortality was greater at younger age groups. So that is why it is important to tell our kids and for us to follow a heart-healthy diet. And confined to subjects who followed a vegetarian diet for more than 5 years, and without a history of cardiovascular disease, they had like less diabetes at the time of recruitment. They all had less mortality. And then there are like very quick landmark studies. There is this Adventist mortality study in 1965. There is Oxford vegetarian study, Heidelberg study, health food shopper study from UK. And all of them, like anywhere, minimum was 24%. Some of the studies showed even 32% lower risk of developing coronary artery disease, less risk of having blood pressure issues, and more meaningful life. So 32% lower risk of developing heart disease, probably mediated where the non-HDL cholesterol was lower and systolic blood pressure was lower, and this was thought to be the reason for developing less heart disease. The other thing is, it's not just mortality, it is not just developing heart disease, angina, because that is a rate limiting step. Patients are going to be like, I'm unable to do. So they looked at 100 patients, studied in 22 different clinics throughout the United States. They just studied them for 12 weeks, 3 months. 74% of the patients were noted to be angina-free, and 9% moved from limiting angina, which means they are unable to do their activities of daily living, to mild angina by following a heart-healthy diet. And another study was done with cardiac rehab, which is also very important for me and Pam, who's here in the audience, where cardiac rehab programs have been shown clearly to reduce readmission, improve quality of life. So they added this compared to the standard dietary regimen. They showed that the anginal frequency was less, body weight improved, systolic blood pressure improved, lower LDL cholesterol, total cholesterol, BMI, and less glucose. So the other important thing is 80% reduction in depression, which happens in people after having had heart disease in 12 weeks. And improvement was maintained at least for a year. So this is a study showing how plant-based diet from Eiselstein, that the coronary angiogram looked much better after 32 months of a plant-based diet. The other study we use in cardiology is called the nuclear stress test, or a PET, positron emission tomography. And the duration of the study was 4 years, looking at improvement in imaging positron emission after following a heart-healthy diet. So to summarize, vegetarian diet, mechanisms for lowering risk, lower serum cholesterol, lower LDL, lower levels of apolipoprotein, lower levels of glucose, age, the advanced glycated AGE products, reduced hemoglobin A1C, better regulation of triglycerides, lower level of inflammatory markers like C-reactive protein, lower BMI, lower systolic and diastolic blood pressure. So I want to quote Albert Einstein, nothing will benefit health and increases the chances for survival of life on earth as the evolution of vegetarian diet. And so the treatment I would like to say we should be using is following a low fat, which is less than 10% of calories. Plant-based diet is a viable, cost-effective treatment. And a plant-based diet can be or should be used in combination with standard treatment regimens, which will include medications and or interventional therapy if needed. And I'm going to just skip through this. So at the end of every talk that I do, keeping a positive attitude is the most important, and wear a smile. It takes only 22 muscles to smile, but takes 37 to frown. So thank you, everyone.